Would you know when to sound the alarm when it comes to your health? When you cough, do you think it's just a cough, or do you think it could be cancer? Today, the 4 biggest symptoms you have. I'm going to tell you when to worry and when it's really no big deal. The first symptom that alarms you, chronic cough. Here's what the alarmist says.
I've had this chronic cough for days now. The longer I have it, the more worried I'm getting. I went on the internet to see if I can get some answers, and it's saying it could be lung cancer. I'm so worried this cough could be something serious.
So Nicole, tell me why you're worried about cancer.
Dr. Oz, I cough all the time. Could be morning till night, could be all day long. And you know, you go online, you don't want to run to the doctor, you go online for a quick little diagnosis, and you see things that freak you out. You see lung cancer and all these major diseases, and you kind of get a little freaked out sometimes.
Can I ask you the questions I would ask my own patient?
Sure.
So first off, do you smoke?
I do not, never have.
Smoke. All right, it's a good sign. The cough, has it changed in its consistency? Is it the same frequency?
Well, sometimes I go into coughing fits, but it's constant all day that there's coughing on and off.
And when you cough, what comes up? What do you find the clinics?
Nothing.
Nothing?
Nothing.
Completely
No,
dry?
Completely dry.
Well, I'm feeling very good about your case.
I'm glad to hear that.
I don't think there's any reason to be alarmed. First of all, you're not smoking, which is a great sign. And a lot of times when people have coughs because of cancer, because the cancer is growing, the cough keeps getting worse because the cancer is irritating your airway, which is causing the issue. So I don't think you have cancer. But I think you ought to keep a couple things in mind. First off, 80% of people who have lung cancer had some smoking history. Okay. So if you don't smoke, you should always feel a bit better about that. Okay. Most of the time, they'll have blood coming out. So I think, reality check, you actually have a chronic cough because of something called post-nasal drip.
Okay.
Which you've heard of.
I have.
But you may not realize that 87% of people, almost everybody who's got a chronic cough, has some degree of post-nasal drip that's actually responsible for it.
Okay.
So I have built you a little model.
I would love
built
to
you
see
a
the
post-nasal drip model. Come over here. This is what I think is going on inside your body. So here's your mouth over here. Mm-hmm. So normally, when you blow your nose, you want some of that stuff coming out over here.
Right.
But post-nasal drip happens because you've got mucus that's draining down the back of your throat. We all have a little bit of stuff. It's supposed to be thin, sort of clear. Right. But when you have something else going on, like an allergy or getting over a cold or something, it begins to look a little greenish like this.
Oh,
and it initially starts off slowly, and then it begins to get worse and worse and worse. You see what happens here? Not very pretty. It spills all over the place. Yeah. Right? Irritates your airways, and that irritation looks like this. And here's the catch. When you have post-nasal drip and you cough, guess what happens to the irritation? The irritation gets
worse.
Now you got this whole area is inflamed way down into this area here. And once that occurs, it becomes a vicious cycle. So if after about 2 weeks, your cough hadn't gotten a bit better, you ought to see a physician just to make sure that's not something we can easily treat. It doesn't mean you have cancer. Okay. Just in case you go to the web and check why 2 weeks of coughing could lead you to a doctor, but it is worth intervening.
Okay.
Thank you very much.
Thank you very much.
The next symptom that's sounding the alarm is breast pain. Let's see the alarmist's take on this.
From time to time, I feel pain in my breast. It really aches. At first, I didn't think anything of it, but then I mentioned it to my girlfriend. So I did. I woke up in the middle of the night with chest pain last night. It was right in my left breast. Now they have me worried that I might have breast cancer. I've been up all night thinking that that's what I might have.
So Kathy's joining us. So why do you think your girlfriends are right?
Well, I think my girlfriends are right because honestly, they Google things for me, and then when I talk to them, they make me worry more.
Yes. And when you feel your breasts, show me how you do it, by the way. You poke at them?
Yeah, I poke at them and just kind of go around. And
do you feel any nodules when you do that?
No, I don't.
And does the pain increase at sometimes this month versus others?
Sometimes the week before my cycle starts, it'll get a little bit worse, and other times not. It just kind of depends on the month, I guess.
So here's the reality check on this one. Because you feel this discomfort in your breast, particularly just before your menstruation starts, I don't think that it's cancer. I think it's much more likely to be hormone changes. But I actually want to show you this, because if you really commit it to memory, you'll process it. So I built you a breast here. Look at this. This is remarkable. And I've asked members of the audience, come on down. I've got a bunch of members of the audience to help me with this. We're going to do a little demonstration. All right? So go ahead and pick up two of these strings. Everyone grab a couple strings there. So hormones are always fluctuating inside your body. I need someone to help me over here. Get a little closer. I don't have cooties. There we are. All right. So as we begin to fluctuate in our hormones, and depending on what time of the month it is, we get big shifts. So, for example, as it gets closer to your menstruation, you have more estrogens. You go up with the hormone as it goes up. Then it goes back down. Then you have progesterone. That actually increases the milk glands. It goes way up. Now the glands are big, the ducts are big, And then what happens when you have your menstruation? You accumulate fluid. You get a big surge, huge. It really engorges the breast tissue, stretches it out as much as it can, and it comes plummeting down. And all those changes cause that pain that so many women feel throughout their breasts when they start to get discomfort related to menstrual cycles. But I'm gonna give you one other little tip. I was just watching you examine your breasts. A lot of times the women that I examine have breast pain because they got nervous about a lump. They rubbed it some more, they rubbed it again, and eventually rubbing and rubbing, you're looking for a nodule, but you're actually causing discomfort. If you're rubbing the back of your arm, you'd have the same kind of pain.
Guilty.
Yeah, so be very gentle as you massage those breasts, and you can allay your fears that way.
Okay.
Thank you very much to all my members of the audience. All right, the next alarming symptom, headaches. Do you worry your headaches are a sign of something more serious? Well, Brittany does.
I've been getting headaches my entire life, but lately they just feel different. It feels like my brain is getting run over by a huge monster truck. I searched headaches and everything that I read said that I probably have a brain tumor. And no one understands what I'm going through. Everyone just thinks that I'm being dramatic.
Brittany, I don't know if you're dramatic, but you are worried you have a brain tumor. Why is that?
Because my headaches are so bad. No one can relate to them. I feel like every time one comes on, then it's worse than the one previous. It literally feels like there's a little man inside of my head, like squeezing my brain repeatedly until I die sometimes. No, seriously, sometimes I really think I'm gonna die, and I don't think I'm being dramatic at all.
And this pain, how many years you been having it for?
I mean, I've gotten headaches my whole life, but this has been for the last, I'd say 2.5 years that they've been like so bad that I feel like a vein popping out of my head.
And that little man or men, one man or multiple men squeezing your head on the inside, what time of the day do they usually do that?
It's usually right after I get out of work.
Here, so put that headache sign exactly where you think it is, right? But the morning here, nighttime over here, where roughly in the day cycle would you put it?
I say that it's around here.
In the afternoon.
Yes, I dismiss my kids at 3 p.m. It starts at about 3:01 p.m.
Yeah. You're a teacher. Thank you for doing that.
Yes.
What grade do you teach?
High school, 9th and 12th grade.
Oh, that could wear you down. All right. So a headache that wakes you up in the middle of the night is the one that I worry about. Not one in the afternoon, but one that happens here at nighttime. And headaches at night are a big issue for us. You need to talk to your doctor if that's happening. Because the reality check here is that since you're having your headaches in the middle of the afternoon, what you're describing and the fact you've had it for a while makes me think it's much more like a tension headache. Okay. Here's what happens at nighttime. Your brain begins to swell a little bit, in part because you're breathing differently, plus your head's flat. And so that extra pressure on top of, let's say you had a brain tumor, the swelling from the brain tumor would make you feel the discomfort. Right. So I'll give you a little home check everyone can do right now. Are you ready? I want you to lean your head forward lower than your waist. Just a little bit lower than your waist. If you do that and your headache gets worse, that's one of the signs that makes me concerned. That it's more than just the usual old tension headache. And the other thing is, if you're probably having that headache for more than a couple months, makes me feel really good that it's not tumor, because tumors grow. And that baby will get worse and worse and worse over a couple months, not over a couple years. Is that helpful?
Yes, definitely.
You still seem worried.
No, that gives me some relief, definitely. Right. Thank you very much.
You can beat up on your friends and give you a heart attack. The
Thank
final
you.
symptom that's alarming you is chronic thirst. Take a look at this woman. She thinks I'm the reason that she's an alarmist.
Lately, I've been dying of thirst, and I'm always looking for something to drink.
A link to diabetes and heart disease.
I've watched many of your shows on diabetes, and I know you said thirst is one of the symptoms. Okay, I have diabetes.
Paris Nicole is blaming you. Why do you worry that you have diabetes?
Because I'm always thirsty. I am so thirsty that I can suck the soul out of a Q-tip.
All right. I'm going to ask you a couple of questions that I usually ask diabetics.
Yes.
First off, when you say you're thirsty, how many times a day do you have to drink water? How bad is it?
I have to be guilty. When I'm thirsty, I always grab for a Coke and a Smile, or I'm grabbing a juice. I'm not really drinking a lot of water, but I'm always thirsty.
So
You got any water now? Really, I'm really thirsty.
I won't give you this, but listen, the thirst comes in many forms. The fact that you're having soda pop and fruit drinks does concern me a bit. But there's a second part of the equation if you're a diabetic. How often do you go to the bathroom?
It's normal, but I still have some concerns. I watch your shows on diabetes, and I'm always Googling, and I feel that I have those symptoms.
Let me ask you the big question.
Yes.
Because symptoms like thirst are sort of vague, so you're going to tie them together. But you have to get up at night to go to the bathroom, to go pee. Mm-hmm. You do?
Yes. Not often.
That's okay, but you do get up at night to go pee.
Yes.
And you go up once, twice, 3 times?
No more than two times.
All right. So if you were a diabetic, you'd have to get up almost every night, and you'd be peeing all the time.
Okay.
Because what happens in diabetes is very different than what happens when you're dehydrated. Because the reality check is, I think you're dehydrated. I think the stuff you're drinking when you get thirsty is not helping your situation, because the caffeinated beverages,
Yes.
the stuff in those drinks will actually flush it out so it doesn't stay in your body the way it's supposed to.
I'm guilty. My personal trainer, Delay, always telling me to put down the Coke and the Smile and
Yes.
pick up a bottle of water.
She's smart.
So
She's telling you the right thing.
Yes.
Let me show you how to differentiate, and this is a pretty good lesson for everybody, between dehydration and diabetes, because there's a big difference,
Okay.
even though they feel the same sometimes. So
Okay.
let's say the sponge is your body, okay?
That little thing right
That
there?
little sponge.
Okay.
And you're going to have to be sugar. So go ahead and put those gloves on, sugar.
Okay.
And so I'm going to pretend that you're drinking some good stuff. Let's say some fluid.
Okay.
And you're desperately dehydrated. So your body says, give me some fluid. So when you drink fluid and your body is dry, see how this is dry like this, not much going on? Guess what happens? Your body soaks up all the fluid. It soaks up everything you give to it. See
Wow.
it growing up there? It won't let any of the fluid go. In fact, it's not going to pee any of the fluid out either. Nothing gets spilled over. It takes
Okay.
everything it can. Now, after a while, your body soaks up all the fluid at once, and it's good to go. Now, if your diabetes is bothering you, and let's say your blood sugar, right? I want you to get your hand and squeeze all the water out of that body. And watch what happens to it. All that urine comes out of you
Wow.
because the sugar flushes it out of your kidneys. It's full in your kidneys. Then what happens? Go ahead and put the body back down again. You drink some more fluid because you're dehydrated. And go ahead, sugar. Let's see what happens. Same deal. You got to pee it all out again. The
Wow.
fluid's not staying where it's supposed to flow. And this repeats itself. Now it's nighttime, and you can't sleep because the body, go ahead, gets you out of bed. You got to pee all the time.
Wow.
So what I want you to do is keep a log not just of what you're drinking,
Okay.
but how much you're peeing.
So I'm good? I'm good to go?
You are good to go.
Awesome.
Thank you for watching. Don't forget to subscribe and turn on notifications so you never miss out on new videos to live the good life.